Hello, everybody. It's Dr. Eric Balcavage, and I'm with my co-host, Dr. Erica Riggleman. We're back for another edition of the Thyroid Answers podcast, and today we have two special guests. So this is a twofer presentation. We have Michelle Campeau and Denise Roguz.
Yes, that's correct. Roguz. Yep.
From ThyroidChange.org. And I was I was doing a little research search, and I came across ThyroidChange.org, and I thought, this sounds interesting. I hadn't really come across your website yet. And I started reading some of the information on there. I said, this is right up our alley. This is really what we're talking about. So I want to welcome both of you to the podcast. We really appreciate you coming on today.
Thank you so much for having us. We really appreciate having this conversation with you.
So can you give us a little bit about each of your backgrounds? Because I know you guys have a little, not necessarily in the world of functional medicine specifically. So can you give us a little bit of your individual backgrounds and how this whole ThyroidChange.org thing came about?
Go ahead, Michelle.
Okay. So, I guess I came about it in a very different way than I expected. Really, it was just following a path. I was probably about 12 when I was diagnosed with thyroid issues. And, I went through life not knowing any significance. And then I had children, and I struggled. So it has to start there in my personal life, because I was lucky enough that at the point of having my third child, I was a communication professor, and I studied social media and the impact of, using mediums to get a message across. And so I was able to speak. I did some research. I was able to find out that the current methods of treating thyroid disease didn't make it insignificant the way that they told me it did. And that infuriated me and frustrated me. And I saw answers that I understood as a non-medical professional, that I felt that if I could communicate it properly, that other people would hear it and that I could save others and maybe make some changes. And it was a really beautiful thing. And the success of it has really shown me a lot. And if it wasn't for Denise, I'm not sure I would have gotten where I got.
So how did you guys come to partner up? Were you guys friends, or what's the story there?
Go ahead, Denise.
Well, I first saw Michelle on a thyroid forum on Facebook, and I saw that she had written a beautiful petition addressed to endocrinologists, and she was discussing her personal struggles in this petition and what she was encountering during her process of figuring out what was wrong with her health. And I saw this beautiful petition in this group that she wrote out of her pure frustration with trying to optimize her own thyroid struggle. And at that time, I was also experiencing a similar story where I was going in circles with my health. Every doctor that I have seen told me that my TSH was fine. I was in the normal range, the whole story there. And I always knew that I had a thyroid problem. I always knew, probably since my teenage years, based on the symptoms I was having. And so I was getting the runaround, and I was finally diagnosed by a functional medical professional. And he basically told me, not even looking at my lab work, he said, I know you're hypothyroid based on all the symptoms you're having and your strong family history. So long story short, I was finally diagnosed probably after, maybe 15, 17 years or so. And that's when I ran across Michelle, and she wrote this beautiful petition, and I thought I'd reach out to her, and we polished it. And from there, we weren't friends. I only knew her as Michelle, as an internet presence, somebody that I didn't know across the miles. And it grew. This petition just snowballed and escalated. We had, with over 2 days, we had over 200 and some signatures, and it just kind of grew and grew. A lot of people were supporting this. And from there, this petition grew into what we know now as ThyroidChange, because we wanted to see a lot of changes in how thyroid disease was diagnosed and treated.
That's really awesome. I think that that's an amazing story, how you two kind of empowered each other, but then used that frustration to be able to turn it into something amazing. Can you tell us a little bit about the petition? So when did it actually start, and how has it progressed over time?
Okay, well, the petition began in about May of 2012. And when we created the petition, or when I began it, what happened was there was a young girl who made these huge changes using change.org petition. And I decided that if she could do it, I could. So I was inspired by this. And I just wrote. I wrote that I saw that patients were becoming innovative, that some of the most innovative treatments I saw were coming out of patients trying to heal themselves. And I felt that there was a huge disconnect. My parents, as I said, are nurses. That means I was raised around physicians. And that means I was raised around medical practitioners. And I know they care. So it was this really odd situation to be in, to see this huge disconnect and rift. And I felt like, hey, pay attention. We have something here, that we need to speak. So Denise and I, when we polished it, we really opened it up and just focused on the fact that TSH isn't a good indicator of thyroid health, or even, what is happening with your thyroid hormone within your body. So we proposed that, if we did more expanded labs, and there were treatment options that included T3, and, that people would maintain their health, and that they would be able to regain that bit that they lose. The problem with the petition is, though, that we had to get people to buy into it. And it was such a small ask, it was like, just pay attention to us. And we sent it to every international organization that we could find. And we just escalated. There was so much help. It was almost as if it was the perfect timing. I know that sounds odd, but it was almost synchronicity of the universe, because we put out this message and people had been waiting to hear it. And it wasn't just patients. Doctors started stepping out, giving us a hand. One by one, people started coming out and saying, yes, I have been sick, and I've been sick for so long, and I don't even know if I have an autoimmune disease. I don't even understand. I've been on this medication. They tell me one pill cures all, one test cures all, and it's not happening. And the validation that came out was phenomenal. And the community that we feel is unsurpassed. And a lot of it's virtual, which is kind of odd, to be honest with you. Like, even us right now connecting through a medium, I have studied this environment forever, and to watch it thrive is absolutely amazing.
That's great. So you guys have the petition done. You got a lot of support. Obviously, the word's growing, but what changes are you starting to see in the conventional medical model, in the conventional endocrinology model, now that you're starting to get more people are starting to say, hey, we want change. Something's not right here. Are you seeing that change in conventional medicine, with more doctors actually starting to run more fuller panels?
I think so. I've seen a lot of integrative type doctors over the last 7 years or so. I also have Lyme disease, so I feel like I've seen a full range of practitioners over the last few years. And from where it was 5 or 7 years ago, at that point, it was rare to find a doctor running full panel tests. I mean, I think it still is in the United States, pretty rare, but at least in the integrative community, it's pretty common. It's still difficult to find a doctor who can run even reverse T3. I am finding that too. Even with my integrative physicians, sometimes it's a little like pulling teeth. But yes, I do think there have been changes over the last few years for sure. But that said, I feel like those changes are happening within the integrative community, not so much with your regular GPs, at least in my experience. And the frustration that we're seeing with other patients seems to be the same case too, especially overseas. There are more changes happening here in the United States, not so much in the UK, in Europe, other parts of the world. These poor patients in the UK, they can't even get their doctors to run a full lab. They can't get T3 at all. They're stuck on levothyroxine.
Yeah, and I think one of the key parts is that it's been the model, right? For 20 plus years, there was a paper put out 20 some years ago that said that TSH represented what the physiology of thyroid hormone in the body, and everybody kind of ran with that process. And even though the clinical research, especially in the last 5 or 10 years, is really, we're learning a ton more about thyroid hormone transport. We're learning more about deiodinase activity, but that hasn't really translated to the medical community at this point. And doctors aren't necessarily bad people. They're doing what they've been taught. They're to some degree, their hands, I think, are kind of tied, because especially when it comes to insurance, especially in the United States, we can speak for that. An insurance-based model, the thought process is we don't need to run tests that don't change our treatment, right? And so in the conventional model, as long as TSH comes back into normal range and T4 is in normal range, we've done our job. We've normalized, I call it physiologic whack-a-mole, right? The whack-a-mole game, that carnival game where you hit the mole. As long as you knock the range back in, everything's good, right? The problem is that mole pops up somewhere else and creates another issue or problem. So we try and bring numbers into normal ranges and artificially make things look good. But that's how doctors are taught. As long as you bring it back in, the rest of the downstream physiology is going to work, even though the clinical research and all the studies show, it's not really the way it works. But I think doctors are tied because they can get their hands slapped too for running tests that are deemed inappropriate because it doesn't change treatment. Having an elevated reverse T3 doesn't change the current treatment, right? Is the TSH normal? Yep, then we've done our job. It seems like there's a huge disconnect between the fact that I'm symptomatic and my labs are normal, and we give the thyroid hormone, we just assume everything else doesn't matter as long as TSH comes back in. And I think doctors are tied. I mean, there's definitely docs out there who are just like, nope, this is it. But I think there's a lot of docs whose hands are tied and say, like, it's not going to change my model. And maybe to be fair, they don't even know what to do if they came back with an elevated reverse T3. What do I do, right?
Absolutely. I definitely think that I've seen a shift over the last couple of years where more patients are coming to me saying, my doctor understands that, we probably need other values, but my insurance won't cover it. And then even if the labs came back, they're like, we don't even know what to do with those values when they come back. And so they usually end up in my office frustrated with their current model because either their doctor won't prescribe them medications when they know they have a thyroid issue, or they can't even get them to run the values that, they feel like is necessary for them. Have you seen with the petition in your whole website that there's been pushback from the medical community?
Sorry. Yes. There has, I study communication. So there's been some rhetoric in even professional papers that I've read that I've seen to be almost a direct pushback at times to messages we've sent. So I'm glad my message was effective and our message has gotten out there and people are speaking. And there's definitely that resistance. The reality is that as a researcher, okay, so I'm not a medical researcher, but as a researcher, I understand that corroboration, studies over time, repeat, studies that we can repeat over and over to see the consistency of them, that's really where we want to create guidelines from. And in America especially, it comes back to the fact that it becomes litigious, right? So at the end of the day, if there's a set of guidelines and you're following them, you can say, I'm not liable. And so I really do understand that, I do. But the truth is that most is not all. And right. I don't care. You can throw out any number you want. You give me 99.9. And I'll say, oh, but what about the 10th of a percent, right? So the 10th of a percent, you put that on a global scale and we're extrapolating numbers out of our perception. So patients really do need to be aware of themselves, and functional medicine and alternate practitioners tend to understand that we are individuals. And there are so many complicating factors to treating thyroid, and it is quite complex. And we did try to industrialize everything to have a step-by-step process. But the step-by-step process is a great guideline, perhaps in the beginning, maybe, but it's really a pattern more than a rule. And that's where it's hard. It's almost like qualitative versus quantitative research. right? Like, I know that's complex, but it's like, hey, I have a bunch of numbers, but what do these numbers actually mean? How does it play out in real life? And so that's why we say, hey, run a couple extra tests and you'll be surprised. And maybe you will start to understand because you have all this training and it's almost instinctual for you. So if you can understand that there's a receptor site being blocked by something that mimics the action of T3 because it's turned into a reverse molecule, an inverted molecule, then hey, ding, 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 this needs to be cleared away. How? That's for your professional care to figure out for us. And we just know that there's a disconnect and there has been a pushback. We truly understand it. The way the system's set up, it's not the same. But at the same time, we're trying to create an environment where people feel willing to take that chance to learn, willing to prescribe medications that truly help us. And we are really saying, listen, it's a benefits risks analysis, and we understand that. But honestly, there's only benefit. We really don't understand the risk.
Right. And I think that one of the things that we need to understand is we can't put people in boxes and treat boxes, right? And that's, I think, the biggest challenge. You could put 10 people in a room who have hypothyroidism and they could all have hypothyroid symptoms or cellular hypothyroidism, glandular hypothyroidism, all for different reasons. And so we have this tendency, especially in the US, to say, if you have the X diagnosis, you get Y treatment, right? Mm-hmm. And we assume that if that doesn't matter what your response is, that's the treatment. And we assume that everybody got there for the same reason, but everybody may have different causes. And one of the things I think is really important, and I wanted to ask, like, what are some of the biggest frustrations you see from the people that you interrelate with on your site and through the organization? But the biggest frustration is when people have hypothyroid symptoms, we often look at that as sometimes as this mistake or a problem. And I think we have a tendency to look at that a little bit differently, which is under stress conditions, one of the things the body does to protect itself, especially at the cellular level, is actually to slow down metabolism, is actually protect the cell itself. And so instead of looking at those symptoms as, oh my gosh, we've got a problem, we've got to give the body something, sometimes we have to take a step back and say, if you're experiencing those symptoms of hypothyroidism, the body's in a protective mode right now. It's trying to slow down metabolism. Now we need to understand why. And I think in the conventional model, there just isn't enough time given to understanding what the why is and trying to uncover that, which could be different for 10 different people, if that makes sense.
Right. A lot of different root causes for a lot of people.
Absolutely.
Sure.
So with the site, obviously you guys have been doing this for a little bit. What do you feel from your community is the biggest frustration that they feel when they're dealing with the medical community regarding hypothyroid symptoms?
We see a couple of different factors going on within our community and online and in social media. One is not so much pertaining to their physicians and being treated, is that they don't know, for one, that they are even hypothyroid. They're experiencing symptoms. Their labs say that they are normal. The TSH says that they are normal, and they're going around in circles with these symptoms. They're not recognizing some of these very telltale symptoms and signs of a thyroid disorder. So they're being prescribed different, remedies, which is actually a thyroid problem at the root. They're being prescribed statins and antidepressants, anti-anxiety medication, a whole slew of symptoms. And until they reach a point where they are totally broken down by thyroid disease, that's when they start investigating further. Okay, what is going on in my body and what's causing these symptoms? And then once they get to that point, they're finding out that they can't find a doctor to run the labs past TSH, or if they are prescribed levothyroxine, they're still displaying symptoms. They can't find that doctor to prescribe natural desiccated thyroid or T3, T4 combination method. So really it comes down to finding the help, especially with our patients overseas. These poor patients, it's 10 times worse overseas.
Oh, wow. Yeah. So when a patient is, when they have those symptoms and they're not sure if they have hypothyroidism or maybe even Hashimoto's. And let's say that their current doctor obviously isn't willing to look or dive deeper into that. What do you suggest to those patients for trying to find a doctor who may be more open to that? You know, what do you suggest to them to, you know, what do they search for? Who are they looking for so that they can, you know, stop having to go from doctor to doctor and kind of nip that frustration?
We actually, when we formed the website for ThyroidChange, we very much so kept this in mind. Whether it be working through insurance or working outside insurance, we created a list. So first, we decided to create a resource. We asked patients where they went to doctors. So let's share our resources. What doctors have you gone to that understand this level of treatment, are willing to do full panels, and are willing to prescribe outside of typical levothyroxine T4 only containing treatments? So we started that list, but it's beyond just a list, because the truth is that they are recommended from patients, and anyone can put themselves on a list. How do you interview people and make sure that they're truly embodying the message that we have? So what we recommend patients do a lot of times is call a pharmacy. Find out what doctors are prescribing particular prescriptions that you perhaps feel would be something in line with your method of treatment. For example, do they prescribe Armour? Which doctors prescribe Armour in the area, right? But we know there's lots more options than just one. So beyond that, we also say check out compounding pharmacies. Doctors who use compounding pharmacies tend to understand the individual needs of patients. We recommend that even, you know, there are many lists, not just ours. We love ours the best, but, you know, check them out. Google those doctors, check out what the patients are saying. Call the office, ask them ahead of time. Google free T3. It's amazing, but doctors who treat with it, they're starting to put them on their website. You know, it's almost like a calling sign of a good physician. You know, like, please come to me. I understand that there's low T3 syndrome. So we are willing to test. So we really recommend, like I said, Googling your area, the different doctors, the different tests that you're looking for, and do your investigation of each of the doctors, even calling and meeting with them first if you'd like to, and discussing with them what their beliefs are. Because it's a relationship. Doctors need patients to speak in order to treat them. Labs don't tell the whole story.
Absolutely, they don't. One of those things as a communication major, or a communication specialist, I should say, right?
Either, and both.
One of the things I think is helpful, and I wonder if you have those things, those resources on the website, where people, they don't know how to talk to. They don't know how to start that discussion. They're intimidated by their doctor, right? This is the doctor. He knows what's best, right? Do you give people some guidelines as to how to bring up the discussion, how to talk about the importance of all those things, so they have some confidence going into their endocrinologist and saying, listen, I want these tests done, and here's why I'm looking to have those tests done. Do you offer those types of resources?
That's a really good question. And I think that's an area that we need to focus on with the website too, is to give more patients, give them some guiding tips on how to begin having that conversation. We have a lot of information on the site, but as you said too, it can be very intimidating. How do you bring that information to your doctor and say, to a doctor who's supposed to be the specialist, right, and say, well, look, this is what I found. So, I mean, we have a PDF printable version of some of the information on the site, but that is a very good point. As far as something concrete that a patient can bring to their doctor, I think that may be our next step.
Because I know there's, patients say to me, because we're helping them, we're running those tests, and they're like, yeah, but how do I explain this to my doctors so that they don't just look at me and just say, listen, you don't have a thyroid problem. You just need to eat less and exercise more. And
I heard that.
Anxiety medication.
I heard that a lot.
Yeah.
And so I actually lost a ton of weight. It's still odd for me to look in the mirror, to be quite honest with you, because of proper treatment. So
Right.
I've heard many times to stop eating, and I eat the same and I weigh different. So that being said, what I did was I had a doctor I trusted, and he was very old school. And I remember I just went to him and I said, listen, I'm sick. And I showed him, I did exactly what Denise and I created. We created a PDF with research studies. And it's just pretty much an annotated bibliography. And I went into him and I said, listen, I still have these symptoms that are listed in these articles. I said, and I see that T3 is something that's really important. Can you guide me? I have to be honest, this was a while ago, and I didn't get the reaction I would have liked. I was told that if I wanted such innovative treatment that I could go to a university hospital.
Right.
But I didn't have to. I found a doctor who was a molecular chemist and became a physician's assistant. So when I brought him the same material, he nodded his head at me and said, it's going to be okay. Yeah. And I actually started crying. So the relief that you can feel is unbelievable. So unfortunately, there isn't really a prescription per se, except for be open and honest with your symptoms. Don't allow them to diminish them. Take the validation of other patients. If you don't feel well, you don't feel well. Make sure that you ask for tests. And if they say no, then understand that you have a right to ask for another doctor. We are patients and we are clients, which means that we have a 50-50 relationship. So you have to give to me and I have to give to you. So don't be scared to say goodbye and find another doctor. And it might feel like doctor shopping at first, but this is your health and this is your life, and we all deserve it.
And I think one of those things in a busy, you hear people say it took me 2 months to get in to see an endocrinologist. And so you've got these people that are worried about leaving their endocrinologist because it'll be months until they get to the next endocrinologist. But many times I just try and point out, listen, it's important that you have an endocrinologist, especially in our world, because both Dr. Eric and I don't prescribe. We really try and do as much as we can through natural methods, diet, lifestyle modification, supplemental support, and really actually getting to root cause. But it's important to have one. But if you're struggling with that endocrinologist anyway, and you're not seeing the changes in the results that you want, why keep paying for that care? Occasionally I'll ask, if you had to pay out of pocket for that endocrinologist's advice, would you pay out of pocket for it? No. So then why do you keep doing it? And so in our model, it's the insurance model. Well, it's $10 copay, but are you getting better? No. Okay. Then you got to look for another opportunity, another doc. And it may take a little bit, but there are those docs out there who are open to understanding that it's not just about a TSH level. It is about how you feel and function.
And we do this all the time, wherever we go, whatever service it is we're looking for, we don't stay with people who don't make us comfortable or aren't giving us what we need. If you paid for siding on your house and your house siding fell off, so, we really do. If you believe that there's something more out there, you need to find someone who's on your level that can discuss it with you and make you feel comfortable with where your health is at and that you are doing everything you can for yourself. It's self-care.
And also too, I think what we're up against, there's that old school model, I think, with a lot of patients, young and old, that their doctor is the person that has been investigating this. They know the research. They should know this stuff, so they trust them. So why should they think differently? So that's where we're trying to, and we don't want to put doctors into this box of that they're the bad guy. For absolutely not. They're, like you said, Dr. Eric, is that they're utilizing what they've been taught and trained.
Right.
But there's more information out there.
That is huge. And I often see where patients come into me and I start explaining the whole thyroid pathway, and, we start diving deep into some of their root causes, and they sit there and they may be in tears, or they're just frustrated and they're angry. And they're like, why doesn't my doctor know this? Why aren't they telling me this? And I often have to say to them that it's probably that your doctor just was never taught this. It's not that they know it and just aren't telling you it. It's that that's just not how they're trained to think about thyroid function. And it really comes down to the schooling for a lot of these doctors.
And continuing education and the amount of time that they have. I thought I read somewhere that the average doctor is seeing between like 20 and 24 patients per day. And this was a local doctor near me, and he went into a different model, more integrative model. But how can you fully diagnose and delve into a patient's symptoms or root causes in 15 minutes with your nose in a lab, and that's it.
Mm-hmm.
So
it's difficult. And yeah, and unless there's, many just don't have time to keep up with the research. I mean, there is some of my favorite authors currently is Dietrich and Hirman. Those guys, I think they're out of Germany. They just keep pumping out awesome research. Their latest paper, one of their latest papers on thyroid allostasis was brilliant. And they talk about, abnormal versus appropriate values, right? We look at a lot of these lab values as abnormal ranges that we have to knock back into norm, but these may be totally appropriate values based on the stressors coming on into a person's life, into their world. So if we look at a reverse T3 and it's elevated, it's not like, oh my gosh, that's a problem. That may be totally expected based on what's going on in their environment. So we have to look at labs and say, what do the labs tell us? Not that we need to play whack-a-mole with them. We need to understand what those labs tell us big picture. Is the body deactivating thyroid hormone? Now we need to understand why. And unless a conventional endocrinologist has time to dig in and read those papers, how's he going to know those things are the newest thing that's coming out?
Yeah, and I think I remember Dr. Kent Holdorf out in California saying that he felt that any changes to guidelines or medical organizations takes about 17 years by the time our doctors are practicing it before the changes are actually made in the guidelines too.
Yeah, till they hit textbook, till it's taught in the classroom, till it comes out. So it's only those that are staying on the cutting edge that are saying, hey, I really want to research these things. And a lot of docs, are educated by the pharmaceutical reps that come into their practice. They say, hey, here's what this med does. Try it on your patients. Let me know how it is. And here's why we're giving it to you. And
thank you.
They go with that, right?
The reason why I say thank you is because ThyroidChange was my response to pharmaceutical PR. I was raised in a family. My father worked for a pharmaceutical organization for many years. They actually educated me and paid for it. But the reason why I'm saying that is because I knew what a strong voice the public relations firms do have and how they go out, and these pharmaceutical reps go right into the doctor's office with their research. And that research is just readily available. So what about the rest of the research that's not so readily available, but equally viable? And we figured, hey, here, we'll show you, and we'll put it into easy language for you as well, for patients as well as doctors, so we can all feel comfortable and have access to this information. Really, it's about facilitating the research. Dietrich, we actually are aware, like the research when it comes out, whether it's through Twitter or whatever, that's how a lot of us are picking it up. He'll tweet his latest research, and we're like, hey, that is wonderful. Look at what you're finding in the December, how we're able to pass out the research and ordinary people be able to touch it and regular doctors be able to. That was a vision, because I just knew the amount of money and finesse in that system.
Yeah, it is. And I think Dietrich's group, they're doing phenomenal work and putting out great content. And I don't think they're getting the mainstream press that they should for some of the papers and some of the information they're putting out. And there are
will, unfortunately, unless this continues with momentum, right? Because you need enough people to beg the attention to continue that relationship. And so we're hoping.
So where do you see, what's your goal? What's your vision for ThyroidChange.org? What's the trajectory? What are you hoping happens in the next 5 years or so?
Ultimately, when we started ThyroidChange 2, and it is still our goal, is we wanted to create an army of like-minded practitioners, organizations, other advocates, patients, everyone coming together to create the change that we need. Because we don't see that the current standards with our medical organization is really what patients need for optimal wellness. So really, that goal still stands. We want to see more people coming together. We want to build that bigger army to put more pressure on our mandating organizations. We also want to give patients the resources the resources that they that can help them navigate the thyroid journey that they're on too. So if they're not able to find a doctor right away, what other things can they do to help mitigate their symptoms? So we want to provide the resources to get them to the doctor, but we also want to help them along their journey too, as far as helping with symptoms. But ultimately, it's providing the resources to get patients where they need to be and to provide that community of like-minded individuals.
I think the resources are key, and that's, you know, part of the reason why we do this podcast is, you know, we want people to understand what they need to ask their doctor. And then if you aren't in the situation where you can have a doctor give you the proper testing, what can you do on your own? What are the first steps that you can try to take hold of your health without having to go to a practitioner? So, you know, having been in the shoes of a lot of our listeners, both of you, you know, have been in their shoes, having a thyroid issue. What have you learned over the last so many years doing this that's beyond just the testing and the medication that patients could start with? What are the top 3 things that they could start with that, you know, they could just make necessary changes that might move them in the right direction while they're looking for a doctor?
Personally, I believe first is educate yourself. The more you educate yourself, the more you empower yourself. So automatically your mindset will start to change. Unfortunately, with thyroid disease, that just, you know, kind of, you fall back. I don't know how else to explain it other than to say you fall back. So if you can empower your mind a little bit, hopefully you could push that momentum forward a little bit and be able to get the energy. Because what people don't realize is that patients actually have to build energy to call a doctor. And that can take a long time. The next thing I would suggest is, in addition to that, start reflecting on your lifestyle. And are there things that you can do? Stress is huge. You already have physiological stress. More likely than not, you have a hormone disorder and it's dysregulated. So your body is already screaming for help. So, you know, be good to yourself. You know, try and take care of yourself and, you know, try and mitigate stress. So if there's people in your life who are stressing you out, making you a little tired, those changes aren't such a bad thing. It's proper self-care. And I'm going to keep going with self-care because then it's going to be nutrition. The reality is, you know, the building blocks of our body come from our environment. So you have to make sure you feed yourself the best you can. So that way you have all of the molecules and everything you need necessary to build the hormone that you're so desperately needing at that point and put off some of the stress that you're under as well. So I'm not sure how Denise would handle it.
No, I agree with you 100%. So yes, I as far as what patients can do, the resources, number one, and also, like you mentioned too, keep educating yourself and keep pushing because you deserve better. And I think a lot of patients don't come to that point until they're totally broken. And that's where I was when I got sick. I mean, everything came to a stop. And I don't think you want to get to that point when everything is broken. And
I think one of the big things that the listeners need to understand, and people who are struggling with thyroid symptoms need to understand, is that if you have hypothyroid symptoms, you look and you say, I have that, I have that, I have that, I have the symptoms of hypothyroidism, then you have a thyroid physiology problem. It doesn't have to be a glandular problem. It can be just a problem at the cellular level. And it comes down to stress. Stress triggers it. You guys both mentioned it. That stress can be physical, it could be chemical, it can be emotional, it could be microbial. Some type of stressor is causing your cellular system to deactivate thyroid hormone, and that's the root cause of hypothyroid symptoms. In time, if that stress becomes chronic, then part of the natural process is to cause autoimmunity, and the release of what they call DAMPs and PAMPs from the cells triggers thyroid hormone autoimmunity, and it's just part of the process. Clinical research can show that out. Now, there's multiple reasons for Hashimoto's develop, but definitely it can be part of that protective mechanism. Great paper, Cell Danger Response, where Dr. Robert Navio kind of talks about the whole aspect of the cell danger response. But you have to understand that from a personal perspective, if you have those types of symptoms, regardless of what your TSH says, there's something wrong, right? If you're putting on weight, normal metabolism works that if you eat more, you either sweat more or you become more active. You don't just pile weight on.
And
So
that's part of like our responsibility as a patient, is to kind of know yourself. And that can be hard because symptoms of thyroid are so, sneaky, and they kind of sneak up on you. But it's almost like if you know you're not a crier and all of a sudden you're crying all the time, take notice. And when you go to the doctor and he says, oh, blows it off in some way, you go, no, there's no logical reason for this. That was where I realized it. It was the logic. The logic didn't dictate my responses anymore. And I went, something else is going on here. I know myself.
Yeah, I'm sure your doctor, said to you at least once, you're eating too much and you're not exercising enough. And to be fair, that's probably the worst advice you can give somebody who's got hypothyroid symptoms, because you're actually going to make the condition worse by trying to exercise yourself skinny, or to try and starve yourself and creating a calorie restricted diet, which is going to cause more hormone deactivation. I mean, it's some of the worst advice you could give somebody.
I was told that I had fork in mouth disease.
Oh.
Did you just hear that? Yeah. So I'm just here to validate everyone. You're not quite feeling like calling the doctor because you don't understand what's going on. Call them. You feel like you're not right. You tell people, they tell you it's in your head. Stop it. You know that you're not eating enough to be the weight, which for me was 100 pounds more than what I weigh right now.
Right.
There's a reason. Go. Please look. There are answers.
And I was the opposite, actually. I didn't have a weight issue. And I was displaying all of these other symptoms of hypothyroidism, going from doctor to doctor. I'm freezing cold all the time. I'm depressed and anxious, dry hair and skin, multitude of other symptoms. But every doctor I saw who was only testing TSH told me, well, you don't have a weight problem. We don't think you could be hypothyroid.
I think that's the biggest trap a lot of women fall into. I mean, guys, I have Hashimoto's as well, but guys can have it too. But I think the biggest trap that women fall into is they'll walk into somebody's office, they're tired, fatigued, they're run down. The doc will look at their stuff and say, look, you don't look bad. I mean,
yeah.
The cover looks good, right? So it's emotional, it's stress, pat you on the head and walk out the door. And you really have to stick up for yourself and say, no, this is not a normal situation.
That is definitely the case. And it's funny because I really do feel for men, because this is well known to be a more quote unquote female issue with estrogen and everything else like that. And the truth was, I was diagnosed at 12 and my father was diagnosed at 30, I guess he was 37 at that time, as a result of me. I can't imagine the symptoms that he probably had all throughout his life and still continues to have. And he didn't speak out because a lot of times it's emotional, and that's okay, right? We all don't like to admit vulnerability, but it's very difficult for women to speak emotionally and be validated by the outside world. And it's hard for men to actually speak emotionally. Generalizations, of course, but that's why we say so much, know yourself. And when you see the little things going off, no, male or female, this is a human problem. And, the humanity in you needs to understand that, yes, there's times of stress, but when you're not reacting properly, you are truly outside of yourself. More likely than not, there's a physiological root cause, and the right professional can help guide you as to what's going on.
Absolutely. Beautifully said. So I know we're getting to the end of our time, and I know there's some other commitments that everybody's got. So final points that you guys would like to make regarding what you want to see Thyroid Change be, or what you'd like to do for people who haven't gone to ThyroidChange.org. What would you like to let them know?
Go ahead, Michelle.
Okay, fine. We all know that I'm the talker. Okay, well, when it comes to Thyroid Change, what we'd really like to see is that the entire purpose and function of it is community and networking, and us all working together to get a voice out there. So what we're really asking for is people to spread our voice and to be part of our voice. So what do I mean by that? I mean that if you're a professional who supports Thyroid Change's message, hey, let us know. Maybe you can provide us with a voice, a blog or something that you have, or something that we can put out there for patients to reach. You have new research, something like that. Well, that's wonderful that you have new research. What we would love for you is to be able to, give it to us. Maybe we can get it out there, flag us, let us know what's going on. We can help disseminate research to our patients. We really just want as many patients to support us and, come out to our mediums, whether it be Twitter or Pinterest, Facebook, and, share the message, because there are so many patients that are unaware of what's happening that we would really like for to reach those patients that they don't even know to be looking for something. So let's share our voice and make it as loud as possible, right? Change happens in numbers.
Yeah.
That's awesome. Mm-hmm.
So they could go to ThyroidChange.org. The petition's still there, right?
It is. It's a little buried on the site right now. We feel like we've moved past the petition in a way, so okay. It's not really an active petition anymore. Okay. But it's there. It's still there for a resource or as a reference to see where we started from. And on the point of researchers and people coming to us so that we can disseminate their information, we recently had a group of researchers in Portugal that came to us just 2 weeks ago, and they're doing a study on endocrine disruptors and thyroid, and they came to us and said, would you be willing to partner with us to help disseminate our information once and if we do get this grant? So that's what we'd like to see too, is other practitioners and researchers coming to us and us working together with them so we can help get the information out.
Awesome. Dr. Erica, any final points?
No, I commend you for all your hard work. I'm sure there's great resistance when you're coming up against big pharma and the medical community sometimes. So just keep going. Don't let people get you down. And I think what you guys are doing is amazing.
Thank you, and thank you so much for your support. Honestly, we can't say it enough. We're we very much so are patients. Yes, we have a lot of medical practitioners backing us, but without medical practitioners and a voice, we wouldn't be able to get anywhere. So thank you so much for speaking out on behalf of patients everywhere. Together, we are going to change this.
All right.
Awesome.
I believe that.
Yeah. Thank you for this opportunity.
Yeah.
Well, we thank you for coming on, and I'm sure we'll put all the contact information, all your socials. We'll put the website information out there. I think on my next Thyroid Thursday, I'll do a little informational on the ThyroidChange.org, so more people can find that. But we really appreciate you coming on and spending some time with us, and maybe we'll have you guys on in the future and see where you've gone in the next 6 months to a year, and we get more of that message out there. So thank you so much for Dr. Erica. We'll sign off from this edition of Thyroid Answers Podcast, and wherever you watch this video, please take a moment to put any questions or comments you have below wherever you watch the video or listen to the podcast. And if you can, go to iTunes and give us a star rating. 5's always the best, so we'll take that so we get our message out there. We're growing every month. We're having great traction, so that's good. People want to hear the messages. So thank you so much, everybody, and thank you to you ladies for coming on today. And Dr. Erica, we'll see you on another edition of Thyroid Answers Podcast. All right?
Bye.
Take care.